Good morning. So, I think I look back over the last 26 years of my life and my career as an endocrinologist. And I'd like to reflect on the fact that there's been so much change in the specialty and the subject in itself. If you look back, way back into 1993, 1994, the clinical aspects of endocrinology were so strong in terms of trying to make a diagnosis of a particular disorder without using a biochemical test. For instance, I remember a parathyroid hormone might take about a month, a growth hormone assay may take about 6 months to get ready, and thyroid function tests may take about a week. So you really had to depend on your clinical skills in certain situations to make a diagnosis. You may have had patients who were fairly ill and who may need, in fact, parathyroid surgery, but you couldn't wait for that long. And so therefore, depending on your clinical skills, a few critical biochemical tests was so important. You had patients who had florid Cushing's disease. You had a first generation MRI scan, which you might pick up a pituitary tumor, but you may not. And on the other hand, you may have had patients with entire negative CT scans of the abdomen, negative MRI, and you had to think about localizing the tumor, but you couldn't. You had biochemical tests, and then you'd start the patient on medical treatment for Cushing's without knowing where the origin was. We didn't have PET scans those days. So the entire gestation period from seeing the patient clinically, doing biochemical tests may have been maybe even a couple of weeks or 3 weeks, and your treatment might have been empirical. And over a period of time, maybe months or years, the tumor would evolve and come to you, and then you'd make a diagnosis. So this is the scenario. If you actually look back, and perhaps if you were not working in that particular era, you might think we were primitive. I don't think we were primitive. I think we just had to use our clinical skills a lot more at that time. Now we are in an era where you can get most hormonal tests within 24 hours. You have imaging which is so comprehensive, and you can pick up many diseases or disorders quite early. And the time period to make a diagnosis may be a week or at max 10 days in the most difficult situations. However, I still think the core values of being a good endocrinologist, and perhaps any major specialty, whether it's nephrology, endocrinology, infectious disease, rheumatology, is you have to be a good physician. Your bedside skills are still so important over here. You should not be thought about as a hormonologist. You should be thought about as an endocrinologist or a physician who has an interest in endocrinology. Spending time with your patients, taking a good, proper history which is lengthy, is still the key. Re-examining your patient on several occasions is very important. And that's how you make a diagnosis.